On today's episode of 26 Minutes with Dr. Warren Siegel on the ZourMed Show, we're diving into a topic that touches every aspect of our well-being, but often gets overlooked: oral health. I'm your host, Dr. Warren Siegel. Joining me today is a distinguished guest, Dr. Polina Ornstein, a renowned expert in the field of dentistry. Together, we'll explore the latest advancements, dispel some common myths, and provide practical advice to keep your smile bright and healthy. Thank you so much, Dr. Ornstein, for joining us today. So tell us a little bit about yourself.
So my name is Polina. I'm from Brooklyn, New York. I actually grew up not too far from South Brooklyn Health. I went to undergrad at Hunter College, and then I did a postbac at Brooklyn College, and later I went to dental school at NYU College of Dentistry. I'm currently a dentist.
So tell me a little bit about your practice. Whenever I tell people I'm going to the dentist, I often get, oh man, I hate going to the dentist. Tell me a little bit, how did you get interested in dentistry?
So I actually had a little bit of an unconventional path to dental school. I studied art history in college, but after I finished college, I realized that I always knew that I wanted to do something in healthcare, but after shadowing a dentist, I realized that I wanted to do dental school and go into dentistry. And that's when I went to Brooklyn College and got a degree in biology and then applied to dental school as well. Dentistry really combines a lot of the things that I enjoy to do. So it combines working with patients, caring for someone's oral health, and eventually you're really dealing with someone's overall health. But it also combines working with your hands and being artistic. So that's why I decided to go into dental school.
Actually, it makes sense if you think about it, art history and making us look better. So we'll talk a little bit about that, but why is it that so many of us are so fearful of the dentist? What is it about dentists that scares so many of us?
So there are actually kind of a few misconceptions about going to the dentist. One of the main misconceptions is that it's going to be painful. And also that you have to wait until you're in pain to go see a dentist. And both kind of go hand in hand, because a lot of patients will put off going to the dentist until they're in pain, and when they're at the dentist, that basically characterizes their entire time at the dentist. And that really shouldn't be the case, because there are a lot of things that we do as dentists that are entirely pain-free and don't even require any type of anesthesia. So anything like a cleaning, to something removable, like working with removable dentures, creating a denture, those procedures are entirely pain-free. There are, of course, some procedures that do require a little bit of drilling or some type of surgery, but before we get started in any of those procedures, we make sure the patient is entirely anesthetized, completely anesthetized. And basically, I always tell my patients that the little prick from the needle is really the only pain you will be feeling when you're at the dentist. And that in itself is a fleeting pain, and it's also relatively minimal and really minimal discomfort. But you also shouldn't wait until you're in pain to go see a dentist. You really should be coming in regularly to see your dentist so that we can catch anything like a cavity in its earlier stages, and not wait until the cavity turns into something that requires a root canal or a crown or even an extraction. So I think those are really the big misconceptions about dentistry, that it's going to hurt and it's going to be something super invasive, and that really shouldn't be the case.
So at what age should children, or I assume young children, start going to the dentist? It sounds like you're saying this is part of being healthy, which is what this program is about. At what age should we start bringing our children to the dentist?
So the first teeth come out, start to erupt at around 6 months of age, and that's really when you should start going to see the dentist, or start bringing your child to see a dentist.
6 months? That's
6 months.
Pretty early.
Yeah. Yeah. So that's when you first start seeing tooth eruption, and that's when you should really be being mindful of your child's oral health. Making sure they don't go to sleep with their mouth full of sugar, or making sure that you wipe their teeth or their gums before they go to bed.
So when you talk about making sure there's no sugar in their mouth, you're talking about falling asleep with a bottle in their mouth?
Exactly.
So that's a no-no.
Yes.
That leads to cavities.
Exactly.
Okay.
So when you think about a cavity, there's really three things that you really need to form a cavity. There's the tooth structure, the tooth, bacteria, and food for the bacteria. And food for bacteria is sugar. Milk is an excellent source of that sugar for bacteria, and that leads to a cavity eventually, unless you wipe that sugar away or clean it off somehow. So something that we recommend for patients or for parents is to replace the milk in the bottle that their child goes to sleep with water instead. So therefore, you're really eliminating one of the main factors that causes a cavity. Additionally, like I said, you can just wipe your child's mouth or their teeth with like a soft cloth before they go to sleep. Just basically the whole idea is that you're cleaning your child's mouth and you're cleaning your own teeth as well before bed.
It's helpful. And at what age should children start brushing their teeth?
So as soon as, well, for little kids, it's hard to tell them to brush their teeth. So we encourage parents to help their kids brush their teeth. So encouraging good habits like brushing and flossing early on, as soon as they first develop teeth, is really important. So that they develop these skills and these habits early on and they continue it throughout their life.
So brushing and flossing. You know, I remember being told you have to brush your teeth after every single meal. Is that true? Is it really true?
Well, I guess that would be ideal if you're brushing your teeth, after every meal so that no food gets stuck. But it's really recommended to brush your teeth twice a day. So once in the morning and once at night. And I always tell my patients that if you want to keep your friends, brush in the morning. If you want to keep your teeth, brush at night.
I love it. That's really very good. I like that.
Yeah.
And flossing. I have to tell you,
Yeah.
I am terrible at flossing. I just don't seem to have the manual dexterity to figure it out. How often should I be flossing? And what do you do for people like me who just can't seem to get the hang of it?
So there are different things that are available even at the pharmacy, at your local pharmacy, that will help patients with flossing. So I understand the manual dexterity can be difficult for some patients, or they just simply forget to floss their teeth. One thing that I recommend for my patients is think of something that you do every single day. So it could be brushing your hair or hopefully brushing your teeth. So leave the floss next to your toothbrush. Leave the floss next to your comb for your hair. And therefore, you're really reminded every single day to floss. And of course, it's recommended to floss, after your meals. But if you're going to be flossing, at least at some point, at least floss at the end of the day. You're cleaning out potentially any food that gets stuck, anything that basically accumulates throughout the day. You're cleaning it out before you go to bed.
So should I brush my teeth first and then floss first and then brush my teeth? It sounds silly, but
Yeah.
concretely, what are people supposed to do?
I don't know if there's actually any significant difference between doing one or the other first, but I would recommend brushing first and then flossing.
Brushing first, then flossing.
For me personally, that's just an easier thing to do.
So brush twice a day, floss at least once a day.
Yeah.
We're getting better. But again, what about those people that just can't seem to figure out how to do it? Is there a helpful hint? Is there something new that I can buy or do to help me floss?
So there are, for patients who don't like to use the floss, there's also something called a water pick that helps you get in between your teeth and clean areas in between your teeth. But one thing to remember really is when you're using floss that you're hugging the tooth. You're not just like pushing the floss in between your teeth and pushing it back out. I know some patients also complain that they're scared that they're going to break something or a filling might come out. If you have really tight contacts or you have a crown, let's say you're scared to get it from it popping out, just pull the floss through your teeth, like push the floss in between your teeth, hug your teeth, clean each side of your tooth. And then you could just pull the floss out. So there's nothing really to be scared of when it comes to flossing. And also there are other things that you could buy at the pharmacy that will help you clean between your teeth in case flossing is difficult.
So you mentioned that going to the dentist and the things that happen during preventive care really aren't painful. What are some of the modern things that have changed in dentistry over the past few years that have make it a little easier for those of us who are afraid to go to the dentist?
So one of the most exciting things for me personally about dentistry is that it's a very innovative field. So there's always something new on the market, whether it's equipment or supplies that we use, there's always something new. And one of the biggest innovations, I would say, that really has helped with diagnosis of cavities, for example, and I really can't imagine working without this, it would be digital x-rays. Digital x-rays are really useful for diagnosis. So it's easier for the patient because they don't have to keep a sensor in their mouth for too long. It's just a quick picture that we take, and that basically gives us a really good image of what's going on that we can't see clinically. Basically, we can't see certain things just by looking at someone's teeth. We need an x-ray to really fully diagnose. And digital x-rays really allow us to get an image populated on the screen. We're able to play with different features like contrasts. We're able to zoom in on certain areas, and it really helps with our diagnosis. And it allows us to have a more accurate diagnosis of whatever's going on in the patient's mouth. Another innovation that I think is really going on with the digital, everything moving toward digital, instead of doing traditional impressions, so like for anyone who's ever had a denture or a crown, they're not new to the idea of having to tolerate taking an impression. It can sometimes be a little bit uncomfortable for patients, but it's obviously something very necessary for us to complete and for us to have an accurate image of the patient's mouth. So it's basically, impressions allow us to have a mold or a model of a patient's mouth, or give us a bite of the accurate bite that a patient has, so we can send this to the lab and fabricate a crown or a denture, whatever the case may be. So there's a move toward digital impressions, essentially. It's easier on the patient, it allows a more accurate image, and it's a much quicker process. So we use a scanner to scan the surface of the tooth, to scan the bite of the teeth, and we're able to send everything out to the lab without having to mail it out, for example. So that's one of a great innovation as well that's been helping us with treatments for our patients. And it's not only easier for us, but it's also easier on the patient.
How often do you have to have that done? When I think of going to my internist, I've got to go at least once a year, sometimes more often. How often should people see their dentist?
So it's recommended to see your dentist twice a year, at least twice a year. It's obviously case by case dependent, but it's recommended to see your provider at least twice a year for cleanings and for checkups. Because we're not only looking at your teeth, but we're looking at other parts of your mouth. Insurances usually cover a checkup every 6 months. So 6 months, I would say, is a good general guideline. But of course, if you need to come in, your dentist will tell you that you need to come in more frequently, maybe every 3 months or maybe every 4 months, depending on the patient.
So you mentioned insurance. I have to ask, why is dentistry so expensive? It seems like no matter how good my insurance is, it doesn't cover whatever my dentist says I need. Why is that?
So, this is something that a lot of patients complain about, that dentistry can be expensive. But like I mentioned, the innovations that we have in dentistry, there are a lot of things that are there are a lot of things behind the scenes that the patient might not be fully aware of that goes into their dental care and their dental treatment. It's not just the dentist doing some type of work, but we also work really closely with labs. We have to send a lot of things to a laboratory to help us process the impressions that we take in order to fabricate a crown, let's say, or a denture. So all of that obviously has some type of fee associated with it. Also, we have a lot of different materials that we use. So every time you come in for a filling, as opposed to, let's say, an extraction or a root canal, we use completely different instruments. So we use a lot of different equipment, a lot of different instruments. So there's a lot that goes into dental care that contributes to the high costs, unfortunately. But there are insurances that do help patients make dentistry a little bit more affordable. And Medicaid is also, in New York State, Medicaid includes dentistry, and includes dental care, and I believe that they just recently expanded to include things like crowns and potentially even implants.
So it sounds like you're telling me that that oral health is a very important part of my health care. And from a prevention standpoint, I should be seeing my dentist at least twice a year. Can you explain why is it so important to have healthy teeth? How does that impact on my overall health?
Mm-hmm. That's a really good question, and maybe my answer is going to sound a little too obvious, but your mouth is really part of your entire body. They're all interconnected. So your mouth is not a distinct part that is completely unrelated to the rest of your body or the rest of your health. There are actually links between things like diabetes and periodontitis, which is gum disease. So they both impact each other. If you have uncontrolled diabetes, it's harder, or you're more likely to get periodontitis, and vice versa. If you have uncontrolled periodontitis, it's harder to control or maintain your diabetes. So in addition to that, when I think about the reason why patients come see a dentist, there's really two main reasons why someone would come. You're either in pain, or you're not happy with the way your teeth look. You're not happy with your smile, you're maybe missing a tooth, and missing a tooth might contribute to you not being able to smile, but it also might contribute to you not being able to eat certain foods. So both are equally important and valid reasons for going to the dentist. So for example, if someone who's had a toothache will tell you that it might be some of the worst pain they've ever felt. It prevents them from going to sleep, or it keeps them up at night. They're not able to drink water. They're not able to bite anything. So it actually has like a really big impact on your overall life, on your daily life. And that's one of the main reasons why it's important for us to care about our teeth and to maintain healthy teeth. We don't want to lose any of our teeth because that also prevents us from eating certain foods, and that obviously impacts our nutritional intake and overall health. But I think also really important to keep in mind is that patients who might not be in pain but are simply not smiling or don't feel comfortable being in social settings or being around other people or shy about their smile, that has a really big impact on their everyday life as well. So I think those are two really big reasons why it's important for us to really care about our oral health and oral hygiene.
That makes perfect sense. I mean, I can see where a sense of self-esteem or lack of self-esteem because you're embarrassed about how you look and your smile, that makes sense. But I didn't realize diabetes, the association between an infection, the gum disease and diabetes. I've also heard that there's also an association between oral health and heart disease. Can you explain that a little bit?
Yeah, so I mean, dental care, dental infections, they can spread to other parts of the body. That has an impact on your overall health, whether it's heart disease or any other, diabetes. There are many different parts of your body that are impacted by your oral health. But there are also things that we see manifest in the mouth before before we even realize there's something systemic going on. So an example would be if a patient has, let's say, uncontrolled HIV, or they're not aware they have HIV, or poorly maintained HIV. They might, in the mouth, we might be seeing some type of candidiasis or some type of infection. So it's really important to be mindful of our overall health, how it affects our oral hygiene or oral health, and vice versa.
You mentioned a little while ago, that dentists don't just deal with teeth, but also the surrounding structures. You made it sound like you're looking at more than my smile when I come to see you. Can you talk about what other parts of my mouth are you looking at besides the gums? That I get, but what else are you looking for?
So we're looking everywhere inside your mouth. When you think about it, your dentist is really the only provider that is doing a thorough exam of your oral cavity. Your general doctor might not be looking at your gums, at your cheek, at your tongue, at all these different parts of your mouth, but the dentist is. So when you're coming to see your dentist, we're not just looking at your teeth. We're not just checking for cavities. We're also, with every new exam that we do and for every checkup, we're doing a quick cancer screening. So that involves doing a head and neck exam. So we're looking at your bone levels, which is related to gum disease or periodontitis, but we're also looking for any lesions, any new lesions, any signs of potential infection. We're checking the top of your tongue, the floor of the mouth, the bottom of your tongue, the sides of your tongue, where we might be pulling your cheek to the side. We're checking your hard palate, your soft palate, and we're also checking your neck to see if there are any lumps or bumps or anything out of the ordinary that might suggest that there's some type of infection going on. And we're really the ones who are screening you for oral cancer and oropharyngeal cancer.
Wow, that's incredible. It sounds like you're doing a lot more than I ever imagined. You're saying I need to see the dentist twice a year. I need to take some responsibility and brush my teeth at least twice a day. I got to start flossing. I've got to see my dentist twice a year, not just for my teeth, not just for my smile, not just so I look good, but that I stay healthy. Can we talk a little bit about what does it mean as we age? I remember years ago when I was a child, it seemed like every commercial was for dentures. I never see anybody with dentures anymore. Is that because they don't do dentures anymore? Are people taking their teeth more seriously and not losing their teeth? What are the things that happen as we get older that we should worry about with our teeth?
So your teeth, there's a big misconception that with age you're going to lose your tooth. But that is not necessarily the case. If you have good oral habits and oral hygiene, you can maintain your teeth for longer. But dentures are still widely used. They are common, but maybe they look a little bit better because of all the different materials that we use and they might look a little bit more aesthetic or more natural. But there's also been a shift toward implants. A lot of my patients will come in if they're missing a tooth or a couple of teeth. They're very interested in getting implants. There are, of course, some people who are still a little bit fearful of doing something more invasive like an implant or any type of surgery. For those people, for those patients, dentures are still a really great option. But implants are really something, they've been around for a long time, but I would say probably in the last maybe 20 or so years, they've become very popular. So the benefit of getting something like an implant is that it's really the most, it's the closest thing you can get to replacing your tooth with an artificial tooth. It's not removable, so it stays in your mouth. The implant gets embedded within your bone, gets integrated in your bone, and after everything heals, you're able to place a crown on top of that implant. So think of it like making a little hole in your bone, putting a screw in that bone, and then eventually placing a crown. So you won't be able to tell that someone is missing a tooth, basically. So that's something that's very attractive to a lot of patients. They're really interested in something like an implant.
Wonderful. So what I'm hearing is going to the dentist doesn't have to be painful. For those of us who are afraid to do things like go to the doctor, go to the dentist, we need to get over this misconception that going there is going to be painful and understand that this is part of good overall health and that it's not just about my smile, it's about my health. This is really fascinating. Could we just finish up talking a little bit about oral cancer? Rates going up, rates going down. How do I decrease the likelihood that I'm going to get oral cancer?
So when we talk about oral cancer, we're talking about the oral cavity or the oropharynx. Basically, we're looking at, like I said, we're looking at your tongue. We're looking at the floor of the mouth, the top of the mouth, and we're also checking behind what we think of as the mouth, behind the oral cavity. So we're checking someone's throat, the soft palate, and something like squamous cell carcinoma, which is the most common of the oral cancers, can be found on any surface, but the more common areas where this cancer is found would be the floor of the mouth or the tongue. There are certain risk factors that are associated with oral cancer, oropharyngeal cancer. And I just want to highlight a couple of them. Tobacco use, whether it's smoking tobacco or chewing tobacco, any type of tobacco use really, like from a pipe, whatever the case may be, increases your risk of getting these cancers. And just wanted to mention that a risk factor doesn't necessarily mean that you're definitely going to get the cancer, but it just increases the likelihood of you getting these cancers. So tobacco use is a big risk factor, and it's something that a patient can control and modify on their own. Alcohol use is actually, in addition to tobacco use, increases your chances of getting these cancers significantly. So if a patient is both a tobacco user and an alcohol user, a heavy alcohol user, it increases their chances of getting these cancers. The men are actually more likely to get these cancers, or it's found more in men, but it could also be found in women. And the age of these people who get these cancers is usually around 64. That's the most common, the average age when we diagnose these cancers. But in almost 20% of cases, they're actually found in patients who are younger than 55. So it's something that everyone should be concerned about.
All great tips, and another reason why I've got to make my appointment with my dentist. Thank you so much for joining us today. Thank you so much for everything you've taught us. And that brings us to the end of our program today. We sincerely thank you for tuning in and learning alongside us. For more information about our show, please don't hesitate to call us at 718-510-2103 or visit us online at www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting our website at www.nychealthandhospitals.org/South Brooklyn-Health. This broadcast was proudly brought to you by Brick Media in partnership with South Brooklyn Health. Until we meet again, stay informed and stay well.